We are opening this conference with the lead report that came out of a 2007 think tank, the Wingspread think tank on domestic violence. And this was a project where representatives of both groups, the AFCC and the National Council of Juvenile and Family Court Judges, met on a couple of very cold, snowy winter days in Wisconsin to talk about issues of domestic violence and to talk about the language of domestic violence and then the notion that not all domestic violence is, in fact, the same. And out of those rather historic discussions came a very fine, I believe, report. And we have the co-authors, co-reporters for that project here with us, Professor Nancy Verstey from William Mitchell College of Law in St. Paul, and Professor Claire Dalton from Northeastern University in Boston. Please welcome.
Good morning. Here in 2007, domestic violence is commonly, if still not perhaps universally, recognized as a serious and widespread problem with potentially far-reaching consequences, not only for its adult victims and perpetrators, but also for their children. But how domestic violence is defined, why it happens, exactly how common or dangerous it is, and how the family court system should respond to it, around these issues there has been surprisingly little agreement. Those working in the field as practitioners have viewed domestic violence from different and sometimes competing perspectives. Researchers have used very different definitions and methodologies, and unsurprisingly have generated a variety of sometimes contradictory findings. The exchanges between camps, as those of you who are regular participants in AFCC conferences know all too well, have sometimes been flat-out acrimonious. Given this history, the convening of the Wingspread Conference to open a productive dialogue about these differences was a remarkable accomplishment. It took courageous leadership from the AFCC and the National Council, and in particular the vision and commitment of Peter Salem and Binnie Lee Dunford Jackson to bring it about. Beyond that, it took faith on the part of each participant that the group would be able to work in good faith, sometimes across long-standing suspicion and disagreement, towards finding common ground, and lay a foundation for better policy, better practices, and better services in support of families affected by domestic violence. Nancy and I were fortunate enough to share in that process as reporters, and are here today, as you've already heard, to share with you what emerged from the conference. That's us at Wingspread. So we started our work asking, can we in fact agree that domestic violence is not a single phenomenon, but a cluster of phenomena? Are we helped by looking at the context in which violence arises in each family? What are the variables that may be helpful in distinguishing one case from another? And can we agree on some general patterns that will guide us in our decisions about how best to respond to the family that is in front of us? So to start at the simplest place, we can agree, the participants at Wingspread did agree, that, for example, a slap doesn't always mean the same thing. It has one connotation in a relationship in which there has been no prior violence, not even a particular history of hostility, no prior evidence of one partner exerting coercive control over the other, but they get into an argument, They touch on a hot-button issue, and one partner at some point loses it and slaps the other. That is very different from a relationship in which there may have been no prior physical violence, but there is an established pattern of one partner trying to control the speech and the conduct of the other. And that, in turn, is very different from a context in which just the week before this particular slap, the partner doing the slapping broke the nose of the other person in the relationship and sent them to the hospital. So far, consensus. Right? But then, almost immediately, the participants at the conference recreated the tensions which, again, you may be familiar with from prior conversations. In trying to differentiate one case from another, and in attending to context, is danger overlooked and the safety of family members compromised. And we talked about the fact that that could be true for two different reasons. One is, which piece of the context are you attending to? Are you asking yourself, what have these two participants in the fight to say about what motivated this individual altercation? And is that your frame for context? Or are you looking more broadly at the entire context of their prior history and relationship? In other words, if we are to look closely at context, can we trust that enough of the context or the relevant pieces of the context are being attended to? Another of the concerns about compromising safety to context is the concern that there may be other factors in the family which, for example, would lead us in the direction of saying, this is a son who very much wants to continue a relationship with his father. He's of an age where that's important. And that piece of the context may overwhelm our concerns about the safety of unrestricted access. So for the folk who are nervous about context and differentiation, it is largely those questions about, will safety be enough of a priority, and will the context be examined broadly enough to determine issues of safety, that creates the reluctance, in a sense, to differentiate. On the other hand, there were many at the conference who are worried that if we do not differentiate, if we insist on a one-size-fits-all solution, we are unnecessarily compromising family relationships and perhaps shutting families out of processes and services that might be useful to them. And the concern there is, for example, that if we define domestic violence for purposes of a custody presumption as a single incident of violence, we may sometimes be engaging that presumption against one parent having access to children when that's not, in that particular case, an appropriate solution. However, we were able at the conference to move beyond those tensions and make some important steps forward in finding common ground. And a big piece of that was then to say, if we look at context, we must always prioritize the issues of safety. And our inquiry must always be broad enough to make sure that we are attending to safety. And in particular, we have to look at the potential for lethality, the risk of future violence, and the presence of other forms of intimidation and control, even when there has been either no prior physical violence or comparatively little. And in this arena, we're increasingly being helped by recent research, which is in many instances actually validated, which is to say it is research that we can rely on as practitioners and judges in the court system, telling us which are the risk indicators that we should be paying most attention to. In one screening instrument that has been developed by Ellis and Stuckless, statistically significant predictors of male violence have been identified. And the authors of that study group those significant predictors into 7 categories: past violence, past abuse, and those perhaps are unsurprising. We would all say, well, of course. Emotional dependency. In other words, is this a relationship in which one partner has made statements like, I can't live without you. You can't leave because I need you here. I can't imagine life without you. If you leave me, I'll take my own life. Emotional dependency is a feature of abusive relationships, and what these authors are telling us, and the participants at Wingspread agreed, was that emotional dependency is an important indicator of the fact that violence may indeed escalate if one partner is trying to get more independence, more separation from the other. Relationship problems. Now that sounds a little vague. In that category, it was hard to get along with communication deficits, blame, and anger. But also control. Has one partner tried to control the other or used violence or abuse to control their partner? Mental health problems, including that one of the partners is on medication, and substance abuse. In another study that Janet Johnston has done, in which she is essentially collecting the results of other people's research, she offers us another list of risk indicators. And there's a significant overlap, in fact, between her findings and what Ellis and Stuckless have done in their recent study. Have there been threats and fantasies of serious harm, even if no serious harm has as yet occurred? That threats and fantasies in these contexts are things that we need to take seriously by themselves. A history of violence, availability of weapons, drug and alcohol use, high depression and rage. A history of mental illness, obsession with or possessive attitude towards the partner. And again, of course, this speaks very largely about control. Disregard or contempt for authority, and the existence of a recent stressor, such as the death of a parent, the loss of a job, in other words, something that may have destabilized an existing equilibrium of some sort within the relationship. So the place to go with this is that the participants at Wingspread found significant agreement that if we could be sure that these aspects of context had been paid attention to, and that the risk of future harm had been seriously considered and factored in to nations about how to help this family, then we might be able to agree that not all violence is alike and that we can differentiate. And so then we began to talk about, well, are there identified patterns of violence which can be a guideline? And here again, we've got something of a tension between, can we individualize and tailor, but are there generalities that can guide us at least down that path? And these are the categories that we came up with as not being definitive, right? These are not categories about which we can say the research has been done, it's been tested, this is the answer. But these are both patterns that have been previously recognized and where we see significant promise that if we continue to explore them, we may indeed be able to come up with more solid confidence that they can guide our decision-making. And at the top of the list is violence in the exercise of coercive control. Second on the list is violent resistance or self-defense. And the critical piece here is to distinguish between what some people have called in the past mutual combat In other words, a relationship in which both partners tend to use violence to resolve conflict. Neither is afraid of the other, neither is in an ongoing way controlling the other, but they're using violence as a strategy in their conflict. To distinguish that situation, which may still be harmful for children, but doesn't have the same risk associated with it usually as violence in the exercise of coercive control. Can we distinguish between mutual combat of that sort and violence that is being used only to resist the violence of a primary perpetrator? The third category is violence driven by conflict. And again, for many of you who've attended these conferences in the past, that's a familiar category. Oh yes, conflict-instigated violence. But what the Wingspread participants have added is, in the absence of coercive control. And so again, what we feel is critical is that extra inquiry into, are we talking about conflict here, or is what is appearing on the surface as conflict in fact masking that coercive control relationship which carries greater risk and also different messages about what interventions and resolutions may be necessary. Similarly, for the separation-instigated violence, the Wingspread participants emerged with a pretty strong consensus that yes, there are cases where the relationship has not been controlling, but the stressor of the separation has produced violence that is anomalous. It's not something that has been characteristic of this relationship or that we expect to be characteristic of it in the future, but that is different, and we need to be sure that that separation-instigated violence, again, isn't masking a coercive control relationship. So if we're to have a separate category, it has to be separation-instigated violence in the absence of coercive control. And then as a final category, violence stemming from severe mental illness. Now the obvious next question is, okay, if this is what we need to be looking for, how do we do it? And I'm leaving that to Nancy.
Tag team does have its value, doesn't it? Not surprisingly, there was a strong consensus at the working conference about the need for screening, that we need careful, high-quality screening. The challenges are, of course, who should do that? And there was consensus among the group that in many cases, no one in a particular court system may be charged with screening, with triage, or with assessment. Some court systems do provide these things, but I think it really varies, and that was reflected in our discussions. So a strong consensus that this is something that needs attention, that we need to focus on high-quality, careful screening, both how it's done and who's going to do it as well. Now, of course, that's easy to say and hard to do. We discussed and spent some time talking about three particular challenges. One is creating protocols that are culturally and socioeconomically appropriate. A second challenge has to do with the fact that any protocols that are developed need to be complex enough to be helpful, but also need to be user-friendly, because these protocols may be used by people in all kinds of different settings, people from different backgrounds, people with different levels of available resources, different amounts of time to do this. And so it's a trick, I think, to figure out, and this will be some ongoing work to be done, how to create instruments that are going to be useful across a variety of settings, but not be, 150 questions or not be one question, which may in fact not be so helpful. Another important issue that people talked about was the need to build in feedback loops. If we're going to be doing screening and assessment, I think it's inevitable that some mistakes will be made. So we need to build in ways to continually improve, but also to allow the families and other people to have input, to say, wait, look at this again, think about this. It's a matter of accountability. And of course, as people come to the courts and they're being counseled about decisions that are being made, they may not realize the difference between a court order and between a suggestion that they participate in a service or whatever. Those decisions aren't appealable in the same way that a court order is. So it's very important that we create an accountable system with lots of avenues for feedback and rethinking of things. We talked about a couple of promising approaches. No definitive answers here, but some promising approaches to the issue of screening and triage. One, and I know there's some tiny little print that I don't expect you to read, I just want to show you the picture, is an approach suggested by Jaffe, Crooks, and Bela, focusing on a multi-method, multi-informant investigation. And this pyramid is basically illustrating that you can start out with a certain level of inquiry, and as more information is uncovered and as more evidence becomes known, that there may be increasing levels of conflict, that there may be violence, then further investigation can be triggered by that knowledge. So that's one possible way of conceptualizing this. Another one, this is building on something that Claire already discussed, is the DOVE instrument created by Ellison Stuckless. And she talked about the fact that they have found some statistically significant predictors that she walked you through that have actually been validated. They also, in their instrument, find a level of risk based on those indicators and link those for mediators, and the instrument is made for mediators, to particular interventions that mediators might undertake. So that if mediation does go forward, depending on the risk level, different kinds of safety precautions are taken. The mediation is structured in a different way. A slight shift to a new topic, processes and services.
But of course, all of these steps are linked to one another in a very integrated way, because the question here is, first of all, what array of services does any court system have to offer all of the families who are making their way through a legal process? And then the question about, if there has been violence in the family, how do we make different decisions, perhaps, about including families within a process, offering families a particular intervention, or deciding that in this case we may, for the sake of safety, have to exclude. And so this goes back to the very first worry about context, that when we sweep with too broad a brush and we lump all families in which there's been violence together, we may be robbing some families of processes and services that they can use productively, or on the other hand, we may be exposing families to processes and services that are not just not helpful, but may in some cases be dangerous. Again, the resources available to the court and its associated services have everything to do with how wide an array and how imaginative an array we can manage to provide, and may also end up dictating whether in fact we can have variations on programs tailored for families in which there has been violence. So I think at Wingspread we talked about our whole wish list of services that we would hope might be available to families. But on this particular issue of inclusion, exclusion, modification of programs to be appropriate for families where there is violence, families where there are different kinds of violence, we talked in particular about mediation and also about parenting education, because those are the places where we felt there had been the widest discussion and disagreement about whether families in which there's been violence should be allowed to mediate, should be required to mediate, whether they should be exempt from a court's mandated parenting education program. And I think it's fair to say that, again, although the results aren't in, as it were, this is all thinking and program development that is preliminary in some ways as we continue to come to grips with these issues. There's some enthusiasm for saying, let's not make blanket decisions about inclusion or exclusion. Let's try to be attentive to what each family could safely use, again, assuming that we can screen in ways that protect safety where that's an issue. And to the extent we can, let's try to modify programs. Let's try to have tailored mediation where we think that we might be able to use it successfully if the parties are never in the same room together. We not rule it out as an alternative. If we're talking about parenting education, then certainly families who have tended to use violence as a conflict strategy, but in which there's not a pattern of coercive control, they might learn a good deal from a parenting education program that teaches them about the impact of their use of violence on their children, and may indeed be able to modify their relationship style in ways that will help their children and allow them to continue to parent even if they are separated, but parent with a degree of cooperation. That's different from a family where the control relationship is so entrenched that many of the messages of the standard parenting education program are going to be counterproductive and leave at least the adult victim of violence feeling like a bad parent because that parent simply can't follow through with the recommendations of the parenting education program because they're dealing with a situation where it's dangerous. So our ideal would be, again, let's try to tailor, let's use our increasing knowledge about how violence works and how it works differently to channel our participants to appropriate services. But again, as long as on the front end our screening is helping us to make sensitive decisions about what will work and what won't, what's safe and what's dangerous, and then at the other end acknowledging that we're always dealing with limited resources and that our capacity to tailor our services is not going to be as large ever as we would like it to be.
Outcomes for children. Courts face conflicting priorities when trying to fashion parenting arrangements. And I think this slide actually illustrates kind of the teeter-totter nature of this, that there are lots of priorities being balanced. And how do we balance them? How do we balance them for individual families? Janet Johnson has made an interesting proposal that she has identified actually 5 different priorities. I know these are tiny print in the back. The first priority, protecting children. The second priority, protecting the safety and well-being of the victim parent. The third priority, respecting the right of an adult victim to direct his or her own life. And fourth, holding the perpetrators accountable. Fifth, allowing children access to both parents. Now, ideally, all of those priorities can be met in an individual case. But as we're aware, in cases where there's allegations of domestic violence or history of domestic violence, that may not be the case. And she proposes that if we can't simultaneously achieve all of these objectives, that the lower priorities on the bottom of the list should give way to those higher up on the list. So, for example, number 5, allowing children access to both parents, may have to be sacrificed in favor of priority 1 or 2, safety of the children and victim. So we thought at Wingspread that it was a very interesting proposal and one that helped people conceptualize that we were, in fact, taking account of some very different but often conflicting priorities, and we need to be thoughtful about how we do that. These priorities, building on that discussion, can be translated into various parenting arrangements. And Jaffe, Crooks, and Bela, I think, have laid these out nicely. In some situations, not many, in my opinion at least, where there's been a history of coercive control, co-parenting is a possibility in some relationships. Parallel parenting, situations where both parents can safely be involved with children, but their conflict level is so high or there's a danger level that requires them to do so on a very separate basis. Supervised exchanges, so that children have some safety and a safe space when children are being exchanged. Supervised access. This, of course, is going to be also dependent upon resources available, but some communities will have supervised visitation centers, and in my previous practice, often we called upon relatives, friends, other people to provide some of that, all the way to no contact. And in some cases, that may be a necessary outcome, but each case evaluated based on the safety of the children and potentially on the priorities as set out by Jan Johnson. It's also important to think about this, and one way of conceptualizing it has to do with the different phases of a typical case working its way through the court system. Parenting arrangements need to be considered in light of the information available at each stage. So, for example, at the temporary hearing stage or early in the process, safety is likely to be a very high priority. We don't have sometimes enough information to do long-term parenting arrangements at that point, but it's very important to keep people safe and to give some breathing space to develop additional information. As we move through the process, moving into more long-term arrangements, it's important to consider those in light of the resources that are actually available to people. And we've talked about that there's a wide range of resources that are available or not available in jurisdictions. And so what kind of arrangements families can benefit from and actually make use of, it really depends upon that. So the lack of resources seriously limits options available to families. Which leads us to the topic overall of resources. There was very strong consensus and a big takeaway message from the working conference about the desperate need for additional resources in the family court system. And I think so many of our comments up to this point have made that even more clear. Statistics show that the courts are seeing increasing family caseloads, that the cases themselves are more serious in nature than ever. We're seeing a big rise in pro se litigants who require more and different resources from the courts. And at the same time that all of this pressure and all of this need is building, many court systems are being cut back and have actually fewer resources than they have historically had. Adding to this, we're asking courts to play a different and additional role than they have historically. We're not just asking courts and judges to decide cases that come before them, that are just presented to them in a somewhat passive way. We're really asking courts now to manage cases. Talk about differentiated case management. This requires new skills, new people, new abilities, new approaches, a different way of thinking about the cases. We're also asking courts to coordinate more, to coordinate with other courts within the system, but also to have relationships with various services and to understand various processes that might be useful. So unified family courts, endorsed in large part by the group, and lots of interesting discussion about how that can benefit people involved in domestic violence situations. You know, there often are going to be multiple courts involved, criminal case, in addition to potential divorce, all kinds of different things, juvenile court case that could be going on. And so the unified family court idea is one that we thought would be useful to discuss more. Given the great need and the strong consensus about the level of need, there was some outrage in the group and some discussion about how do we go forward from here. And there was a faction of people who wanted to see judges marching in the street to really raise awareness about this. We probably won't include that as a formal recommendation, but others who favored more the polite, continuous pressure. But a level of urgency about this, because families, of course, need these services, need the best that we can give them.
I'm recognizing as we, stand here and try to convey to you the substance of what we left Wingspread with, it doesn't do justice to the mood of the actual conference. And it sounds cliched, but I do just want to say I wish you had all been there. It was quite extraordinary to be for 3 days with a collection of people with very strong opinions, a huge amount of expertise and knowledge, and to feel as if, as a group, we were finding new ways of communicating our beliefs, sharing our priorities, opening our ears and minds to one another. And I think that we came away from Wingspread with a head of steam about new possibilities that had to do with taking these many voices and establishing a basis for new collaboration. So it feels, I'm not inclined to be messianic, but it feels like the beginning of something important. And in some ways that seems strange to say when we've been at this and worrying about these issues and, all of us trying to do better for the families that we study or we work with for so many years. But it does feel like an important moment for being able to say maybe there is now some new ground that we can move on to together and get even better at the things that we do in service of the families that we are assisting.
Well, as Claire said, people, I think, left the conference very energized. Lots of fresh perspectives were discussed, new research discussed, innovative ideas came forward, and I think there was a level of sort of excited exhaustion as we actually left. But many things to consider, to roll around in people's heads, and I think there have been many interesting discussions following the conference as well. An immediate question, of course, came up about, well, what exactly happens now? And there were people who really strongly felt that we needed to immediately begin to implement some of these ideas, some of these thoughts, some of these perspectives. After all, when you're looking at clients or constituents in the face and they need something and you've heard something at a conference that you think you might be able to use, you want to make use of it right away if you can. On the other hand, others felt that we needed to be cautious because of the danger of unintended consequences, because we need to know more in some areas, we need to get different perspectives. And so I think people agreed that we should go forward in some way to look at best practices, to take the best knowledge that we have, the best ideas that people have, and start to formulate something that can be implemented in different ways in different jurisdictions. So I call it moving forward with cautious immediacy. The next steps. Well, people, of course, would have, at least I would have loved to have stayed for another week or two to work on all of this, but people had to go home. And so participants, people who were there, did commit to participating in some ongoing working groups to keep some of these discussions going. And several of the topics that people identified include working on creating and settling, at least to some extent, on a common vocabulary, because many people from professional backgrounds and different backgrounds and from different perspectives may be talking about some of the same things but using some different words. And so it would be helpful for all of us to sort of speak the same dialect, or at least to understand when we're not. More research and investigation about potential patterns of domestic violence, when those can be useful, when they might be misleading, and investigating hypotheses related to them. Another group interested in developing culturally sensitive screening and triage protocols. Another group interested in making recommendations for intervention and referral. How do we go about that? And also a group developing best practices regarding how we can make truly child-centered custody and access determinations. So hopefully these discussions will be going forward and we'll be seeing continued work on these very important topics. Another thing that will be happening is that we are going to be publishing a special issue, a domestic violence issue of the Family Court Review, which should be available next summer. And it's going to be devoted to many of the topics that we have talked about here today. It will contain the report that Claire and I are putting the finishing touches on, the Wingspread report. We'll give you much more detail than we've been able to go in today, as well as some references and hopefully some things to think about. And we'll be interested in your ongoing comments about that. There are also going to be some very interesting articles because we've been able to pair some authors who historically may have come, some of them from different perspectives, but agreed to work together on important topics. And I know that many of those authors are having interesting discussions. I'm one of the co-editors along with Kelly Brow-Olson, and so we've gotten to see advanced copies of the articles. And I can tell you, I think some of these articles are really groundbreaking. And so I'm very excited about the issue, and I encourage you all to wait with bated breath for it to come out. But I think you'll find it to be very helpful. And it's a great service, I think, that this group, in combination with the National Council, has done to provide this opportunity. And I want to again reinforce the leadership of the two groups who had the foresight to bring this together. And I think we're starting to make some advances, be walking on the same path. And who knows where it could lead. Some references, if you want them, to things we referred to.